Nationwide, 1 in 8 women are diagnosed with breast cancer. That's about 13% of all women. By the end of this year, more than 43,000 women are expected to die from the disease. To raise awareness and educate people on how they can lower their risk of breast cancer, the Mayo Clinic is hosting an online seminar this Tuesday called Living Well During and After Breast Cancer. Joining us now via Zoom to talk with us about the event is Dr. Mussallem from the Mayo Clinic's Jacoby Center for Breast Health, So good morning, doctor. Thank you so much for joining us this morning.
Good morning. I'm so excited to be here. It's wonderful when I can help to impact multiple lives rather than just one life at a time, though I really cherish that time with my patients. It's really powerful when we get to have the presence in front of a group of people. And that's why we're doing this event on Tuesday.
Absolutely. Well, in addition to regular self-exams and mammograms, what can women do to reduce their risk of cancer?
That's a great question. And mammograms are so important because they help to reduce deaths from breast cancer by finding breast cancer early when it's more treatable. But when we're talking about primary prevention, we're really talking about how women live. And about 33% of all breast cancer cases are actually preventable if we could live healthier lifestyles. And if we change the way we live early on in life, we think that that preventable number goes up as high as 50 to 70%. So things we look at is trying to maintain and avoid weight gain throughout your entire life. And once a woman is postmenopausal, we really want to focus on the importance on avoiding overweight or obesity. And we turn our focus to nutrition because nutrition is really the biggest driver to help with maintaining that weight. And in fact, there was a recent study published by the Women's Health Initiative that looked at 49,000 women who had never had breast cancer. And they followed these women for about 19.6 years is how long they followed these women. And they found that the women who ate a low-fat diet that was rich in whole grains, vegetables, and fruits had a decreased risk of dying from breast cancer. And this is a really fantastic study because that's the kind of endpoint we want to look at is how can we improve and enhance the longevity of our life expectancy. So it was a great study. Other things like physical activity can reduce the risk of breast cancer by 10 to 20%. And alcohol, we did a study at Mayo Clinic a few years back to see how many women knew that alcohol increased the risk of breast cancer, and over 50% of patients surveyed did not know there was a risk. In 2014, there was a study published looking at alcohol and related deaths, and there was over 6,000 deaths caused from alcohol alone related to breast cancer and alcohol consumption. And breastfeeding is protective. Women who breastfeed versus women who don't, there's a 14% decrease in breast cancer risk. So there's so much we can do. And if you put that overall package together, you get a really robust risk reduction.
Wow. So what about when you've been diagnosed with cancer already? Can some of these practices help?
Absolutely. And, it kind of goes right along those same exact lifestyle recommendations. And so we really like to work with women as soon as they're diagnosed with breast cancer. It's really old school thinking to tell a cancer patient or a breast cancer patient for the purposes of a discussion, eat whatever you want, don't exercise, don't do too much. In fact, I want my women as soon as they're diagnosed, if they weren't eating healthy before they were diagnosed, to start eating healthy right away. And there was a study called the Diabetes Reduction Study. It came out of the Nurses' Health Study. And what they showed is women who consumed a healthier diet that was low in sugar-sweetened beverages like fruit juice, it increased high fiber foods like cereal fiber, whole fruits were important, vegetables. It reduced saturated fat. It encouraged polyunsaturated fat. It avoided red meat. And things like coffee and nuts were actually seen to be favorable. And in this particular study, in women who had a breast cancer diagnosis, they followed them for about 14 years. And they saw that the women who were more adherent to this healthy type of a diet lived longer. And it was really cool because they took the same group of women and they looked at a different set of information to find which vegetables and fruits maybe had the biggest impact. And I love this part. And so what they found is that green leafy vegetables, cruciferous vegetables, and berries really had a big impact. So I always give that as homework, and anyone attending the webinar on Tuesday, that's going to be part of their homework, is they need to get 1 serving of cruciferous vegetables, 2 servings of green leafy vegetables, and try to get at least a cup of berries every day.
That is incredible. Well, thank you so much, Dr. Dawn Mussallem. We unfortunately have run out of time, but for more information, you can visit news4jax.com to visit and learn more about how you can register for this event. And thank you again, Dr. Dawn Mussallem from the Mayo Clinic. It was a pleasure having you.